The former head of the Centers for Disease Control and Prevention recently called out Minnesota as one of the best in the country when it comes to the overall reporting of COVID-19 data. Dr. Thomas Frieden was quoted in the New York Times article singling out Minnesota as the overall leader in the country. He leads a nonprofit called Resolve to Save Lives, which looks at COVID-19 metrics being reported by states across the country to inform communities and public health action. Minnesota was the leader, reporting 43% of the 15 metrics, which include things like cases, deaths, mask use, and isolation time.
A lot of these gaps that we're seeing in the data are things that are present around the country, and it's largely due to investment in public health infrastructure. So public health infrastructure right now is being pushed and taxed, especially on the data side. And many of the infrastructure systems we're using are older. They're not as nimble, they're not as flexible. And so while Minnesota has made great strides over the last few years to build up that capacity, some of our gaps still highlight challenges with our current system and structures that will be fixed in time, but it's hard to do it in the middle of a crisis.
The more data we have on people with COVID-19, the better we can address what's going on in public health to try to make things better. So data is a bunch of numbers, maybe a spreadsheet, but we can look at it all together and say what's going on. For example, we saw earlier that the number of younger people with COVID-19 was increasing. So that allowed us to say that our communications department should focus their communications and outreach on the younger community because we know that they were having an uptick.